So this is a visual to talk a little bit about what we've been exploring so far. All humans get dysregulated when they feel threatened. However, the word threat is very subjective. Like we talked about, trauma can be subjective. What things are triggers to our reactions can be subjective. But these things put us into fight or flight. So here's a picture of the window of tolerance. When we are within our window of tolerance, we can act as our best selves. We can act in a way that we would reflect upon and say, yeah, I used the best skills that I had. I did my best. I worked as hard as I could. That feels like me. But when we are dysregulated, we generally fall either into the hyperarousal zone or the hypoarousal zone. So if we're hyperaroused, this is those kids who maybe seem really anxious or easily irritated, angry. And a lot of things go in with that. When our body is wrapped up so much, we are probably having a hard time sleeping. Probably our heart rate is higher. Probably have some kind of racing thoughts or digestion issues. A lot of these things can go hand in hand. On the flip side, if we get hypo-aroused, this is more what we think of people who tend to dissociate. So they may feel disconnected from their experience. They may be overly compliant. So they might just do whatever is asked of them just to get through the situation. They might seem withdrawn, depressed, and attentive. So already, I'm sure you can start to see how if we are outside of our window of tolerance, a lot of these behaviors can look like a lot of things. Some can be autism related, some can be ADHD related, some can be depression or anxiety. That as soon as we're outside of our window of tolerance, our access to the things that help us stay within our best selves reduces. And novel situations, so encountering things for the first time, can bring about some level of dysregulation for all of us. So those with trauma may even wake up in the morning. They may start their day every day already dysregulated. So, whereas I'm waking up and I might look at my phone, I might check the weather. Somebody who's dysregulated already might have some of these anxious feelings or depressive feelings, making it easier for them to get more and more dysregulated throughout the day. The other side of that cookie is that soothing is subjective, just as threat is subjective, soothing is as well. So what is relaxing and comforting to me is going to be different than what is relaxing and comforting to somebody else. So I might go and try to hug somebody who's having a really hard time, and that might be the last thing that that person wants. In fact, that might send them into a greater state of dysregulation. So being really mindful and thoughtful about that person's experience, their history, their current presentation of behaviors, all those things are really important to take into account when we understand why behavior is happening and also how to respond to it.